Well, welcome everybody. Today is unbelievably May 12th, but we're going to air this recorded episode on May 19th, 2021. I'm Trey Dobson, Chief Medical Officer at Southwestern Vermont Medical Center and an emergency medicine physician with Dartmouth-Hitchcock Health. And this is Medical Matters Weekly, a show about the aspects of healthcare that matter to you most. And my guest today that I'm very excited to have is Dr. David Furman. He's a gastroenterologist with Dartmouth-Hitchcock at SVMC in our SVMC gastroenterology office, as well as in the hospital. He is a native New Englander. He has a medical degree from Boston University School of Medicine, 11 years as an officer and physician in the United States Navy. He is a veteran of war in Afghanistan, having proudly served there from 2012 to 2013. Got his fellowship in gastroenterology at Walter Reed Hospital in Washington, D.C., and the National Naval Medical Center in Bethesda, Maryland, and it goes on and on. Welcome, David, to our show.
Thank you for having me.
Yeah, we're so psyched to have you here. And let's just start a little bit about your background. Tell us a little bit about where you grew up and then all the way through how you ended up here.
Yeah, well, as you mentioned, I am a native New Englander, a different part of New England. I grew up in the Boston suburbs. Actually grew up in Lexington, Massachusetts, the birthplace of America's freedom. And it's actually, there must have been something in the stars, or must be in my blood, to be living in a colonial town, because walking around Old Town Bennington or Manchester Village and seeing the colonial houses and the white churches, and it feels like Lexington once again. Grew up in New England, grew up watching the Red Sox and cheering for the Celtics. And of course, that was the 80s, so the Patriots weren't a whole lot to cheer for. But it was really kind of an idyllic community. Lexington itself, if you're not familiar with it, is just outside of Boston, and is really just a very nice suburb. Has a product of the public schools there. And but it's always been, New England is New England as far as I'm concerned.
And now you're in an area where you read about the Green Mountain Boys that you used to read about, or at least you're living among that area. That's great. And so then, you grew up there, and then you decided to go into medicine. What brought you into medicine?
It was actually somewhat of a convoluted path to medicine. I often counsel young people that don't be discouraged if you don't know what you want to do, because eventually it all works out. When I had originally gone off to college, I really had no idea that I was going to end up in medicine, and it really was sort of an afterthought. Found my way into medicine, believe it or not, to become a neurologist after developing a fascination with neuroepiphenomenon. Was a big fan of Oliver Sacks and things that happen when people get head injuries.
Yes.
But as it turned out, when I got to medical school, when I finally had the opportunity to rotate in neurology, it really was not something that interested me in clinical practice. One of the greatest pieces of advice someone had given me, one of my mentors in medical school had given me, was they said, when choosing a specialty, don't choose something based on the most exciting, fascinating part of that specialty, because every specialty has something that's fascinating and exciting. What you really need to choose is something based on what you're going to be dealing with on its most banal, day-to-day, run-of-the-mill exposures, because that's, of course, what you're going to be doing. And so neurology, headaches and seizure medications just wasn't my cup of tea. Once I discovered gastroenterology, however, and discovered that I could talk to people about their bodily functions and their eating habits, and talk about cancer prevention and abdominal pain and all these things that to me really were quite fascinating. So that's how I ended up where I am now. Now, interestingly, there were lots of things within medicine that I really enjoyed. But even before going to medical school, I had done a brief period of time where I was a speech language pathologist, again, pursuing that interest in neurophenomenon and neurolinguistics. And so going to medical school to become a neurologist was really going to be a continuation of that. One of the things that gastroenterology has really offered me is that part of the purview of the gastroenterologist is swallowing impairments, and that is also part of the purview of speech pathologists. So some of that early training that I had back in my speech path days has really come to benefit me as a gastroenterologist as well.
Oh, that's great. Yeah, actually, a lot of us in medicine don't really have exposure from different fields. And I bet you that does give you a little bit of different insight and perspective into the problems people face. So you went into the military then after you were in medical school or before?
Yeah, so each of the branches of the U.S. military, or at least the Air Force, the Army, and the Navy, each offer scholarship programs for physicians. This is a way for these branches of the service to be able to recruit physicians. And the way that the scholarship works is they pay your way through medical school, and in exchange, you owe them a certain amount of time back. So for me, doing medical school, already 30 years old, was, I didn't really know how I was going to pay for it. And the U.S. Navy offered a hand, and I accepted it. So I was in the scholarship program, and it really turned out to be a fantastic program. If there's anyone out there who has ever considered a career in medicine and is wondering about how to finance their education, I really encourage looking into the military. It's called the HPSP scholarship programs. And so I was able to go through a civilian medical school, Boston University, got a great education there, and then went and did my postgraduate medical training, so my internship, a residency, and then fellowship as well in wearing the uniform in military facilities, and got great training doing that. And I never appreciated how much pride I would have wearing a uniform, but it really was a great opportunity for me and a great experience.
And so when you went to Afghanistan, Dr. Furman, what were you doing there as far as gastroenterology? That's not what a lot of us think about, but I have my own thoughts.
No, and that's a great question. And the other question I'm sure comes to mind is, what was a Navy doctor doing in a landlocked country like Afghanistan?
Yes.
But that's another story. So I actually was in Afghanistan not as a gastroenterologist per se, but just as an internist. And actually, I was not there doing patient care. I was part of NATO forces, helping win the hearts and minds of the Afghan people, and trying to prop up the Afghan government and support them. And so what I was there doing was I was helping the Afghan Army's medical corps create medical residency programs so that they could train their own doctors.
Wow.
Historically in Afghanistan, people become doctors through a tutelage program, basically an apprentice program. If you go through medical school, and medical schools are not formal like we have here, and once you have gotten your medical degree, if you are fortunate enough to know someone who is already a doctor and they're willing to take you under their wing, you become whatever specialty they are, and you learn whatever they already know, or whatever they don't know. But they don't have the evidence-based multidisciplinary training programs that we have in Western countries. So we were helping them create such a program. While I was there, I wrote about 2,000 pages of curriculum for a residency program, and kind of helped them get that started up. It was really quite fascinating, but certainly I wasn't there as a gastroenterologist.
Well, what an experience. I do have a close friend and colleague who is in the Navy, or was in the Navy as an otolaryngologist in Afghanistan for a few years. And he said he actually, ended up treating a lot of the U.S. forces out there, right? So they need doctors too. And but that is excellent that you're working in education. So let's talk about gastroenterology just a little bit. And as an emergency physician, of course, I refer patients to you all the time. A lot of primary care does, a lot of surgery. But for someone in the audience here who's not in medicine, what is a gastroenterologist, and what do they do?
Well, my kids would tell you I'm a poop doctor. But no, so gastroenterology is actually a very broad field that encompasses all of digestive disease. Basically everything from swallowing function to stomach function, intestinal function. It also involves hepatology, meaning study of the liver. We're involved in diseases of the pancreas as well. And so it's really a multifaceted discipline. And one of the things that really interested me, and one of the things I really enjoy about gastroenterology, is it's just as important in wellness as it is in disease. And so there are a lot of preventative medicine aspects of gastroenterology, and of course, colon cancer screening, which is incredibly important, but also general wellness and nutrition are part of gastroenterology. The other thing that really appeals to me in my particular area of interest within gastroenterology is what we refer to as benign functional disease. Not everything that we need to see a doctor about is life-threatening, but certainly in terms of gastrointestinal conditions, a lot of it really affects quality of life. And so, simple things like being able to eat a meal and not feel uncomfortable afterwards are things that a lot of people struggle with. And gastroenterology is the field that hopefully can help out with that.
And for the audience as well, if you're not familiar, now, of course, many of you are, and you've actually seen a gastroenterologist yourself, or you've had a family member see one, or one, is that gastroenterologists, they sort of bridge, they're internists by training, so internal medicine, and then also are proceduralists, nearly like surgeons, doing lots of procedures. And Dr. Furman, just tell me a little bit about the procedural offerings here at Southwestern Vermont Medical Center.
Sure. So generally speaking, when we're talking about gastroenterologic procedures or gastrointestinal procedures, we're talking about we call endoscopy. Endoscopy is technology where we use a fiber optic camera scope that is able to go in through a natural orifice, usually the mouth or the backside, and examine the inside of the digestive organs. So our two kind of bread and butter endoscopic procedures that we do here are what are called upper endoscopies. This is our way for evaluating upper digestive conditions. Also allows us to screen for things like stomach cancer or esophageal cancer in appropriate people. But more often it's diagnostic evaluations for people who are having issues with chronic acid reflux issues. We call dyspepsia, discomfort after you eat, abdominal pain. And through that camera, we can do both therapeutics. If someone happens to, for example, be bleeding, we can acutely go in and fix those bleeds. But we also are able to do biopsies to help make diagnoses. Of course, at the other end, we're doing colonoscopies. This is our gold standard, best way of screening for colon cancer, but it's also a way of, again, evaluating for certain lower digestive symptoms and intervening if someone has bleeding. There are more advanced procedures that can be done endoscopically that we are also doing here with the help of some more specialized of my colleagues, where we can do procedures to intervene for issues with gallstones. We can also do diagnostic procedures to evaluate diseases of the pancreas, diseases of the bile duct, and so those are the general procedures that we're doing here.
So for the audience that's local here, let me just give you a little background or a little bit of what's going on in gastroenterology now. So we have Dr. Furman as well as his partner, Dr. Kola Kumar, both gastroenterologists. We have an office with many a nursing team and support services. And then we have all of the endoscopy procedural area that Dr. Furman was talking about in the hospital. But outside of the service area, because this podcast goes beyond here and in much of the rest of the state of Vermont, there's University of Vermont Medical Center. Almost all of the community hospitals also have gastroenterology, and then Dartmouth Hitchcock, of which Dr. Furman is a part of our DH system. So if you have questions on that, you can contact us and we'll help you. Contact your primary care doctor. They know how to get you into the right place. And we are improving access. Access throughout the state for gastroenterology has been difficult, but it's improving. We are also recruiting a third gastroenterologist to join Dr. Furman and Dr. Kumar. and as well as increase our procedural ability. So those are just some exciting news because I know people that are listening want to know. So let me ask you a little bit about some of your experiences and what you can shed some light on. Just tell us about in your career, what are some of the more exciting things that you've seen in gastroenterology?
Yeah, so it's interesting question. A lot of times when I can imagine that when doctors are relaying what are some of their most memorable experiences or most rewarding experiences, it's going to be the exciting thing. They cured some disease or saved a life, and certainly I have had opportunities where I've acutely intervened for someone who was really quite ill and been able to help turn them around, and of course that is very rewarding. But for me, really the most rewarding part of my job are again, these day-to-day interactions, these more banal kinds of interactions with people who have chronic digestive issues. And over the years, my specialty personally is, again, in this functional realm of referred to as neuro-gastroenterology, conditions like irritable bowel syndrome. Mm-hmm. A lot of people who have irritable bowel syndrome have been unfortunately suffering from their condition for years and years, oftentimes going from doctor to doctor and largely being brushed aside, being told, oh, it's nothing serious, just deal with it. And my approach is really quite different. When I see these patients, the first thing that I want to do is educate them on why their body feels the way that it does and why it's responding the way that it does. And I frame that in the context of their digestive nervous system dysfunction. And I try to reassure them and that what they're experiencing is not in their head, they're not imagining it. But it also is very, even though it's not dangerous, it certainly is serious and can really affect quality of life and really can be life altering. So through that, I've really formed some very, very strong relationships with people, very strong therapeutic relationships. And even though I always counsel people that I won't necessarily be able to cure them of that irritable bowel or whatever else, we can at least help manage it together. And I've often had patients relate to me and say, you're the first person who made me feel like I wasn't crazy, or made me feel like I wasn't making this up or wasting their time. And I think that that's an important role for us is to be not just handing out medication, but also being a therapeutic ear and being a support. So.
Well, I can tell you, you've been here a short time. We're looking forward to you spending the rest of your career here. You've already made a tremendous difference. I see that in the patients that I'm aware of in the emergency department. I hear about it in the community. I want to thank you for that. You also have a wonderful team with Dr. Kumar and the staff. What are you thinking in the future over the next 5 to 10 years? What would you like to see gastroenterology in this local area look like?
Well, there are a lot of very exciting things that are occurring in gastroenterology as a science these days. We have made over the past 5 or 10 years our number of therapeutic agents for treating very, very difficult diseases like Crohn's disease and ulcerative colitis have really blossomed. We are doing some collaborative work with our colleagues at Dartmouth Hitchcock Medical Center with their inflammatory bowel disease program. And so hopefully that's something that we'll be able to get off the ground more here as well. One of the great frontiers in medicine in general, but in gastroenterology specifically, is understanding we call the microbiome. This is the bacteria that live in our digestive tract. We really think that it's probably the key to lots of disease and lots of wellness. And there's lots of great research that's being done into that. And we're hoping that therapeutics to be able to alter that microbiome and provide treatment for diseases is going to continue to grow, and that we'll be part of that as well. And then in terms of endoscopic therapeutics, that's also a very fast growing field. These days, in addition to being able to do things like biopsies and stopping bleeding, there are gastroenterologists who are able to actually do called non-invasive surgery or endoscopic surgery. They can actually resect tumors. They can do other kind of very, very advanced procedures through the endoscope. And really would be wonderful if we can develop that capability here as well.
Right, and I'll echo that. I want the audience to understand that Dr. Furman is a super addition, and we're going to keep growing the gastroenterology service as well as other services. We don't want people to have to travel for medical care. We want to do what we can here. We have excellent physicians and staff, and our collaboration with Dartmouth-Hitchcock allows us to keep more people here for advanced procedures. So we're excited. Thank you again for joining us, Dr. Furman of SVMC Gastroenterology. We'll talk with you again in the near future. Thanks everyone in the audience for joining us on Medical Matters Weekly. Again, this is a taped broadcast today for May 19th. I'd like to also thank Mike Cutler from CAT TV, Ray Smith from Southwestern Vermont Healthcare, and Ashley Jowett from Southwestern Vermont Healthcare. Next week, we will have Dr. Tamar Schmall of SVMC OBGYN and Deborah Moan, a nurse on women's and children's at SVMC. We can send your questions ahead of time to wellness@svhealthcare.org. I'm Trey Dobson. Go out and find joy in everything you do, even in the face of adversity, and we'll see you next week.